Hello, my name is Jacqueline Padilla and my video is going to be on why female genitalia mutilation should be stopped. According to Women's Health Organization, more than 3 million girls are at risk for female genitalia mutilation. This is a procedure practiced by Africa, Middle East, and Asia. Female genitalia mutilation is four different kind of procedures. There's a type 1, type 2, type 3, which is these two, and there's also a type 4, which is called the NIC. There are many reasons why this procedure should be stopped. There are a few long-term and short-term risks that come with this procedure. Some of the long-term risks that come with it is urinary tract problems, there's health problems, birth problems. Sometimes the female dies and suffers from hemorrhage, they get shock, and sometimes during these procedures the scar tissue doesn't heal right. I believe that this act should be stopped because it is against human rights. A lot of these females are forced to perform this procedure because of many differences from the location they're from. Some of them believe because it's their religion, even though many of the biblical books do not show that this is required of a female. Some of them say because it's tradition. Some say because it gives more pleasure for the male, and there's a lot more. There's also because they believe that a female should not feel pleasure while in intercourse, or because she is more likely to become married if her private area looks like this. They believe that it increases marriage probability, even though it doesn't. It really doesn't. So the types of procedure that there's this type 1, which is called clitorectomy, where they remove the clitoris and leave everything else. Type 2 is where they remove the clitoris and a little bit of the labia minora. Type 2 is where they remove the clitoris, labia minora, and labia majora. And then there's type 3, which is these two, which is the most hardest on a female, where they completely remove everything and they sew it up together. Sometimes they leave it open about that much or completely shut. And when this procedure is done, the female goes through a harsh procedure. She is cut, she is sewed up, and then after all of this, the shaman or whoever practices it ties up their legs and leaves them like that, so they believe that the scar tissue can heal on top of the wound and make it heal faster and make it more pleasurable for the male. Of course, with this type 3, there is a lot of complications. During birthing, they hemorrhage a lot. Sometimes it causes the child to die during birthing, and during intercourse, most of the time these females are ripped open and continue to bleed out. But this is seen normal, so once they rip open, they are sent back to get sewn back up. So this is a continuous pain that they feel. And like I said, there are not a lot of people like this, and the ages range from 5 years old to 18 years old that these females are getting this. This little girl right here is being pinned down and cut with a razor blade. No anesthesia, no cleaning, no nothing. That risks infection, fever, shock, death. As you can see that there was bleeding on the floor already. This is now an older girl. She is, I believe the picture says she was around 16 years old. She's also being forced to perform this procedure. And as you can see, this is not a sterile procedure. This is probably an old person that this is their tradition, that they preach this, a shaman or whatever he is performing this. Of course, there is where you can say a part where 80% of Egyptian females still voluntarily do this. They believe that this is part of their heritage, is part of how they grew up, that this is a rite of passage. But there's not hospitals, there's not regulations or rules set for them. This is just something practiced throughout their family or culture, where other people can say this should still be performed because males get circumcised, so why shouldn't females? This is completely different. The malehood is only cut off, and this is done when they're at birth. Whereas the female, she is completely cut off. All of her sensation, or if not, some of it is removed from her vagina, and she suffers constant pain, whereas a male does not. This is a procedure done in sterile anesthetic, and it has been practiced for a long time. Of course, this has been practiced for many, many years from different countries and different parts, but it is not a sterile procedure, and every single time there comes with complication. There was a hospital in Michigan that was performing the NICS, which was the type 4, where they take a syringe, they poke the clitoris, they take out some blood, and they essentially cut a little bit of skin off. To them, that did not seem inhumane, but they were prosecuted because it is against the laws. And some of the states have laws to protect people that have FGM, but by average, most don't. And this epidemic is actually spreading to California. Not to California, to the US, because migrants are coming here and bringing their traditions, and then they know that this is against regulations, but they still, however, take them outside of the country to go get this procedure done in their home country, and then they come back. And that is also against mutilation. That's called vacation cutting. So this actually has been a battle for a few amount of years. I want to say about 20 years now. This has been brought up slowly throughout the years about bringing more laws and more rules and more protection for these females that are being forced against their right and violating their human rights to stop this, but not everyone knows this. So this is why I believe this procedure should be stopped, because it is inhumane, it is against a human's rights. The female is left with constant pain just for a possibility that it gives them more stats, higher rate for them to get marriage, because it keeps them a virgin longer, because they believe that the female won't want to risk and hurt herself and cut herself open again. All of these reasons and side effects and symptoms and all of these causes are not something legitimate for a female to go through this pain. And this is why I believe that genitalia mutilation should be stopped.